It was a really cute car. So I am going to introduce our next speaker, who is Stuart Karten. He is the president of the award-winning LA-based product design and innovative consultancy, Karten Design. Stuart and his creative team partner with leading medical device and consumer product manufacturers to create extraordinary experiences between products and people. And most of you probably don't know that Stuart lives on an island in the middle of LA. I did not know that there were islands in the middle of LA, but he lives there. And he is here today to speak about designing the future, the Uberization of healthcare. Please join me in welcoming Stuart Karten.
Morning, everybody. Thank you for that introduction. And yes, I do live on an island. How many of you here have seen the Spike Jonze movie, Her? Okay, a few of you. I'm going to start with a little montage that I put together from that movie that I'd like you to watch.
Oh, I'd have to see if there was some... I can't believe I'm having this conversation with my computer.
You're not. You're having this conversation with me.
So... I'm available.
Hey, you just got an email from Mark Lumen.
What are you talking about?
Read email.
Okay, I will read email for Theodore Twombly.
Where are you?
I am... I don't have a body. I live in a computer. You have a meeting in 5 minutes.
Oh, I forgot. Thank you. Ah, you're good.
Yes, I am.
This is the future. This is a love story between a man and technology, his operating system. And what makes Samantha so compelling is that she is powerful. Clearly, there are huge algorithms that are in play in the background that drive her. She's ubiquitous. She goes everywhere that Theodore goes. And she's intuitive. You can hear the way he talks to her. It's natural. Even when she talks to him in an unnatural way, like read email, she makes fun of him. So I want you to think about this as I go forward, and I'll come back to the movie. So what I want to do with you today is just take you on a little journey out into the future, my vision of where the future of healthcare is going, and at least highlight some of the things that I think are going to be important to us as we look towards that future. So let's start with technology. This is 2 pictures taken from the last inauguration of the Pope in the Vatican. In 2005, 2 billion smartphones were in play at that point, and then literally a few years later, 6.9 billion smartphones. So this is something that's not new to us. We know that consumer technology is accelerating at a super fast pace, but typically medical technology follows along at a little slower pace. And so let's look at where we were and how we got here. A lot of Lisa's comments resonated with me, and you'll hear me kind of echo some of that. So up until now, what's been at the center of all of our focus has been clinicians. As we're designing services or products, we're looking at doctors, nurses, technicians, and we're understanding what their needs are and what their focus is. And then we come to 2015, and again, to echo where Lisa was going, we have some major convergence of things that are going on. Accountable care, we have this widespread connectivity, we have the sophistication of sensors, we have a rise of chronic conditions, aging of boomers, ballooning healthcare costs, and to echo again what Lisa said, the water is boiling. This is an unbelievable time for innovation and to actually leverage these convergence issues. So we have clinicians that have been in the center, but now we have patients that we're starting to look at. And in fact, it's becoming imperative to engage with patients because we have to make sure they don't readmit themselves back into the hospital. So how many here are fans of Uber? How many actually love Uber? Okay. So I think Uber is an actually great metaphor for where we're at and where things are heading in the healthcare space. So as we look at what started with where we were with Uber, taxi drivers were in the power position. Limousine drivers, they thought they owned the whole experience, and they drove the experience. but it was actually a horrible experience for us, right? We had to hail cabs, we had to call cabs, we had to get in the back of cabs that had no room for our feet. They smelled, all those additional things that just made that experience horrible. And then here comes Uber, and they completely flip the paradigm. They put passengers in the center, and they go at it through the experience of what a passenger wants. The ease of use, the ability to call them anytime, split fares, even to the point where they're delivering things beyond people. So this is really what Uber has done for the taxi industry. And so what I predict is we're going to have a shift over time, and that patients are going to become the key stakeholders and the power position for what drives the healthcare system. And as we all know, even in the Uber scenario, there were regulatory issues that they were struggling with, and they continue to struggle with those, but all in the service of creating what is a better user experience. And I think everybody here could basically echo, whether it's through your own experience or through, you know about people interfacing with the healthcare system is horrible, okay? And I predict that that's going to change. And what it's going to do is it's going to create empowered patients. Just the way we have consumers now that have the ability to use the web to search up the best restaurants, to look at who ate there, to see the photos of those restaurants, and to have that really good user experience and have choice, we're going to end up with empowered patients. So we're going to see a switch in a business model from B2B to B2C. And as we look beyond 2015, and as we see the 80 billion internet-connected devices that are going to be in use by 2024, okay, this is my big data slide. You're going to see all of this feeding into this cloud. And then what's going to be really interesting is when artificial intelligence really comes along and is able to parse that data, bring back information to the people how they want it and where they want it. And we saw with Watson Health being deployed by major corporations in the last few weeks, this is starting to actually happen. Now, where we started to see it happen is in some of the digital wearables, whether they be fitness and some medical wearables. I have my own opinions about wearables. The good are they promise behavior change, right? Most people think if you put a Fitbit in, you're going to lose weight just by putting it on. They deliver information. Whether that's information that's actionable or not, I think is debatable. And they're easy to integrate into your life. You can buy one, put one on, you're ready to go. The bad is that it's a force fit into things we wear. And with the Apple Watch coming, I think it's actually forced as a fashion statement. For a guy who has minimal places to actually make a personal statement, the watch is really important to me, and I'm not sure I'm going to be wanting to be that guy with that watch. And also they're temporary, so you can actually take them off. My vision of where wearables are going is that Nirvana is about bringing macro information to us when and where we want it, and to manipulate that digital and real-world information. So how have we seen people do this? We've seen it with eyes, with the Google Glass. We're seeing it developed around the wrist, and we also have seen it with ears as well. And I put together this little crude video just to illustrate where I think it might be heading.
Greetings, David, how are you and the wife? Joan and your kids? Johnny and Jane? Greetings, David, how are you and your wife? Joan and the kids? Johnny and Jane? Greetings, David, how are you and your wife? Joan and the kids? Johnny and Jane?
So you see the potential of the audio input, which I still feel has not fully been explored. If you look in the movie Her, that's how he gets his information. And for the last 7 years, we've been designing hearing aids, and we've been completely immersed in what it means to actually have that audio experience and what that drives. And by the way, I'm sure you guys have heard the term glass holes, right? Those are people who are wearing Google Glass. I'm coining a new term called glance holes. What blows my mind is if I was sitting with you and talking to you and I did this, the message I'm sending you is, I'm done, right? So let's all get used to that. So the future is not wearable, it's invisible. And what I mean by that is from two perspectives. One is I believe that technology is going to migrate into the body, okay, instead of on the body. We're going to see things like electroceuticals and implants and sensors that are put in the body in the service of actually addressing conditions in earlier stages. And the other part of it is, the other invisible element is that it blends with your habits and ceremonies. It's easy to adopt. You don't have to be making a statement. Some of the work that we've done on hearing aids, it disappears. You can actually use an iPhone and geotag where you are or where your favorite coffee shop is, and the next time you walk in, it adjusts automatically to that setting. So let's go out to the future, 2025. I want to come back to the movie Her, and what I want to do is just put yourself through the lens of somebody like him, but in a medical or a healthcare scenario. So personal care will take over. Imagine that's a doctor or a coach in his ear. He's got personalized medicine with genomic data. We have smart environments. You saw when he walked in, lights came on, things happened automatically. Well, maybe they'll notify of your medications to take, suggest proper foods for you to eat. And I believe we're going to start seeing treatment at home. So we'll see diagnostic devices that collect and analyze and send info to your doctors and teach you how to do minor procedures at home as well. As we look to 2035 and 2045, to me that's science fiction. It's really no way to actually fully predict what's going to happen at that stage, but I've taken a shot at it. And I believe what we're going to see is proactive engagement. This is at birth. You'll have a health roadmap, a vision for prevention and early intervention. You'll have a bespoke medical team that engages with you at every part of your health management, and you'll see ubiquitous engagement everywhere and anywhere. You'll have contextually intelligent homes. These will be driven by your personal data combined with artificial intelligence. You'll see the key places, the health hub of the home, which is the bathroom, and your bedroom will adapt and morph to your current health status and life stage. A lot of talk about aging in place. I think those things will have come into play and actually be integrated into your life. And areas of your home might transition into potential treatment environments. So your home will be looked at as a holistic environment that'll carry you from birth to death. And then we will see the full consumerization of healthcare at that point. Uber's tag is everyone's private driver. At this point, it'll be everyone's medical concierge. This won't be driven by those who are well endowed that can have their own medical concierge at this stage. So let's come back to 2015. What can we do to prepare ourselves for this future? Obviously, we need to put a renewed focus on consumers and patients. And traditionally, what we've done is we've looked at the cognitive elements and the physical elements. We've looked at what it takes to, about learning, memory, attention. We've looked at the physical, and that's really where it stopped. My proposition is that going forward, we have to look at people in a much more holistic way. We'll have to understand the context of where they are and what they're doing. We'll have to understand where they are in development. Are they in puberty? Are they aging? Where are they in their development? Social will become critical as well. Understanding the ecosystem that surrounds people, their caregivers, their family, and the support that they can bring to people when you're sick. And then lastly, what I believe is the most critical element and the most hard to understand, which is the emotional component. How do people feel? What do they need? How do they view themselves? And I believe as researchers and engineers and designers and marketers, we need to be tapping into people's emotions. We need to bring them solutions that are ubiquitous, intuitive, and powerful. And maybe if we do that, we can create experiences that people love. Thank you.
Great, loved your view of the future. With innovation outpacing reimbursement mechanisms and the rise of consumerism, how do you anticipate payment and those transactions will occur going forward?
So I'm going to tell you right away, I'm a designer and I don't really study that part of the process. And what I would say to that is it goes back to the regulatory piece, okay? If that is going to be your focus, you're going to have trouble innovating. You need to be a rebel, you need to break the rules and go against everything that's out there and experiment and try new things. That's my advice at that point.
So to be provocative here,
please.
Women get an alpha-fetoprotein test at what, 10, 14 weeks maybe, right? with genetic testing capability, what makes you believe that by 2025, we don't already know the healthcare plan for the infant?
I'm sorry, I didn't hear the last part of that.
What makes you think that by 2025, we won't already know the disease profile and the healthcare plan for the infant before it's born?
Is that a question, or are you telling me that? Will that happen? Yes. I hope so.
You were talking about wearables, but you were talking about wearables.
Yes.
I don't know if this is even on.
It is.
Okay. But you didn't mention anything about robotics, and everything that I've seen is like robots will be in the home helping older people. And have you looked into that at all?
I haven't looked into it. It hasn't been anything that we've been practicing around. My first impression is that if you look at where I landed, which is about really connecting with people and on an emotional level, I'm not so sure that robots are going to be the best solutions for helping people. I mean, what I'm seeing right now is that people are taking technology and just throwing it at solutions. And they're not really understanding what people want and are interested in. For example, I have lots of people coming to us who are trying to understand how to monitor people aging in place. And they're putting cameras and sensors in their beds and the walls and what's happening is people don't want to be stalked. They really don't want to be watched in this way. And it goes counter to what they're feeling. Whereas, a caregiver is like, but it's great. I get to wake up in the morning and see what what my dad is doing. So I'd be cautious about the robotic piece of things and whether that's really going to be the true solution for, creating better experiences.
Thank you.
Just quick, not to get too broad on you, but we do a lot of user experience research, and I'm just curious what you found in terms of getting over that hurdle. It's not just the companies who have the hurdle, but the patients themselves to agree to this or to want to, engage with this technology just because it exists. I mean, we see that in a very kind of analog way with medication. Just because it will help them doesn't mean that they go to it. And so I guess I'm just curious in your travels what you've seen in terms of getting over that hurdle for those who aren't early adopters or easy, sort of easy targets.
Yeah, and I touched on it a little bit. So what I talk about is people have habits and ceremonies, okay? And there are things that everybody loves to do in their life. Unfortunately, getting sick and dealing with medication, all things that are not really things people are that excited or interested in. So if you're going to change behavior, if you want to get people over that hurdle, you have to be able to create solutions that blend with people's existing habits and ceremonies. It's really hard to get somebody to try something completely new that breaks from what they're doing. So as an example, if people are, if they're currently doing something or they have a metaphor for how they do something or they've created a ceremony of how to do something, if you can tap into that and blend it with that so they actually feel like it's just part of what they normally do versus completely learning and getting mind share around something different. And part of that is really doing in-depth ethnography and spending time with people and contextual inquiry, getting empathy. I think that's one of the things that our clients lack at this point, or the real empathetic experience Lisa talked about, and displayed it very well this morning. That ability to really talk to people and understand how they're truly feeling.
One more question?
Stuart, I know this isn't a design question, but I think it's a kind of a big one. This vision that you paint, and I sign up for that. I think you're right. The implications it has for the roles and responsibilities of the healthcare professionals is, to me, huge. I mean, being a doctor ain't going to be what it was, and the players. What we now have, there are doctors and there are nurse practitioners, and there are this sense of delivery, in essence, if the doctors are the taxi drivers.
Right.
And I'm not sure what sort of a complete revolution in the educational system for these people or in the sociology of this profession is going to have to take place for your vision to happen.
Good question. I think at one extreme, what we're seeing is brands are now actually looking at coming into these experiences, right? So we're having interlopers into this whole area like Samsung and CVS and Walgreens. And I think what's going to happen for people who are currently in that situation, they're going to have to change their mindset. And I'm going to go back to the Uber example. The good thing about Uber is it wasn't an amazing experience for just passengers. It actually put new people to work, and it gave them jobs. And whether you know it or not, you know they can rate us as well after the ride. So I think that whole perspective of treating people differently and understanding that they have a different role is going to have to take place over time. And they're going to have a different, you know, with the heating up of potentially competition, which is what's going to be the future, that people will have choice, it will affect service just the way it does in any industry. So there will be the ability to, there'll have to be the ability to teach these people how to treat patients differently and how to approach them in a different way.
Thank you so much.
Thank you, everybody.